Good afternoon, everybody. Bienvenue.
Welcome
to this special day, the celebration of the second launch of the UNESCO Chair on Global Health and Education. And I will be your leader for this afternoon, so you will hear me a lot. Hopefully you're okay with that. If not, I'm sorry. No choice. So I'm the manager of the UNESCO Chair on Global Health and Education. So first of all, I want to give the floor to Monsieur François Aubert. François Aubert is the president of the steering committee of the UNESCO Chair and is working at the Université Clermont-Auvergne, where he is also the vice president of the Fondation UCA. François, the floor is yours.
So on the behalf of Professor Matthias Bernard, president of the University Clermont-Auvergne, I'm representing because he cannot join us today for professional reasons. I'm very proud to welcome you in Paris at UNESCO headquarters as president of the steering committee of the chair for the official launch of its second mandate, as Ruth said. So technically speaking, the UNESCO Chair is technically supported by the MGN Foundation, so the Group VIV, and the Foundation of the University Clermont-Auvergne, so organization in which I'm serving as vice president since 2021. So today it's a hybrid meeting. So here at UNESCO headquarters, we are with about 80 people in person, and in addition, 200 participants are joining us online. So we have a diverse audience today from 35 countries from every region in the world, which in my view represent a truly global community of the UNESCO Chair, its relevance and its excellence. So thanks to Daniel, to its dynamism, the UCA Foundation and its university, the UNESCO Chair is the only one and is a highly significant structuring project for us. It contributes substantially to its international recognition in terms of both academic research and teaching. So under the leadership and commitment of the two co-chair holders, Nicolas and Didier, the chair's focuses on producing and sharing knowledge, aiming at promoting health for all. So the chair is supporting institutions and contributes to reducing inequalities all over the world. So the program of this journey is particularly rich and diversified, and I wish you a very good meeting for sharing knowledge, And I think this evening we are going to pass a very good moment together close to the Tour Eiffel. So Didier, Nicolas, thanks a lot for everything you have done so far. Thank you, and thank you.
No. Before we continue, we would like to make a statement, and I read it out. The UNESCO Chair acknowledges the tragic caused by wars and the climate change that are taking place in the world. This affects the most vulnerable in our societies, in particular children and young people. The solution to the existing inequities is not found in war or another, one people trying to dominate another. There are no human enemies. There are enough resources in our world for everyone to lead a full and good life. This is what our chair wants to contribute to. DJ.
Thank you very much for this statement, and once again, welcome to each and every one of you. You all know that our chair is a UNESCO chair, but also a Center for Collaboration with the WHO. Our mission is to, first and foremost, to serve the United Nations and these two agencies, and our mandate is therefore given to us by these two UN agencies, and this is why both these organizations are going to first take the floor, and we have the honor of having among us Mr. Sobi Tawil, who is the Director of the Future of Learning and Innovation at UNESCO, who is going to say a few words of introduction on behalf of UNESCO for this launch ceremony of the second mandate. Thank you very much. I am going to speak in English.
To welcome you all, ladies and gentlemen, and colleagues, co-chairs, and members of the steering committee of the UNESCO Chair on Global Health and Education, partners, la Commission Nationale Française, and all the champions of health, education, sustainable development who are here in person in the room today, but also all those who are connected. And really on behalf of Assistant Director General for Education, Stefania Giannini, who could not make it, but just to welcome you and to say that it's a real pleasure to be able to say a few words on her behalf at the launch of this second mandate, the second phase of the UNESCO Chair on Global Health and Education. And I think first to say that the growth and the influence of the chair since it was first established is remarkable and must be underlined and recognized and applauded. And it really exemplifies and amplifies UNESCO's functions as a laboratory of ideas, as a capacity builder, as a catalyst for international cooperation. And we see from the activities of the chair during the pandemic, the knowledge sharing activities that you're involved in, the efforts in the Global South, the collaboration with other UNESCO chairs are all really perfect illustrations, I would say, of the spirit of the chair's program as we go forward. And the work really illuminates the link between education and health and reinforces the belief that a healthy mind can only thrive in a healthy body and vice versa. It's particularly for us, managing the chair's program, which is a house-wide program, it's inspiring to see the intersectoral approach, the policies and practices. I say that because our challenges, increasingly, it is perhaps clearer in the area of health, but our challenges today looking ahead are increasingly interconnected, and we need to be at the intersection of different disciplines and sectors. I think the approach of the chair in general can be qualified as one that goes beyond traditional approaches, looks and grapples with the root causes and factors that affect health and its relation to education. And in this way resonates very well, I would say, with the UNESCO mandate for a broader, more holistic development. To add to that, I think the focus on sub-Saharan Africa, especially in terms of school health, in terms of nutrition, in terms of gender equality, are perfectly aligned with UNESCO priorities. Let me perhaps say something, and many of you will be aware of a publication that was released earlier this year in February, Ready to Learn and Thrive, UNESCO publication, jointly developed with a number of partners, and that looks at the global status of school health and nutrition. And I think two sets of observations we can derive from that. First, a confirmation, the evidence and the findings of the study confirm perhaps what we already know or believe, but that health, nutrition, and well-being are key determinants of learning outcomes and of educational outcomes, and therefore must be considered as an integral part of what we consider quality education. And to take a few figures from that publication, the introduction of school meals shown to increase enrollment and attendance by 8–9%. The fact of having free vision screening and glasses in schools, and the way in which that has an impact on test results in reading and mathematics. Perhaps more astonishing is the introduction of hand washing in low-income countries, and the effect that has, spectacular, that ranges between 20% and 60% in terms of reducing absenteeism. On the other hand, the second set of observations around the remaining challenges and gaps in scaling up quality school health and nutrition programs, that only half the countries in the world, if we're looking at the global level, provide school-based mental health promotion and prevention programs. Only half. In low-income countries, that's only 1 in 4. That school feeding programs at the primary level in low-income countries have a reach on average of 20% of learners, so efforts there in scaling further. That school-based vaccination programs in low-income countries it's about 1 in 4 low-income countries that do have school-based vaccination programs. So we still see the challenge and the remaining gaps in scaling up. But to say that to effectively transform education, we do need to consider the learner, the child learner as a whole, and put learners' health and well-being at the center of the mission of education today. And I think it is two things in relation to the COVID pandemic and to the UN Transforming Education Summit last year. First, in relation to the pandemic, I think we rediscovered, or many rediscovered, that schools are more than about education, and that they are important centers of health and well-being and protection, and we realize that. Second, to say in the Transforming Education Summit that was convened by the UN Secretary General last year, in terms of the educational recovery from COVID, countries were more likely to flag student well-being, psychosocial support, and health issues over learning loss. We were very much focused during COVID and school closures on falling behind on the education, but we realized that it's a whole, and there is this primary importance of schools in terms of centers for health and mental well-being. Looking ahead at the Chair's next mandate, the second phase, the ambition to make every school a foundation for healthy lives, the emphasis on lifelong learning for health, and the visionary approach, I would say, of harnessing health resources in everyday community settings, I think defines a kind of roadmap and a vision, and is optimistic. the conceptual framework that links education, health, and sustainable development, and that is rooted in collaboration, in inclusiveness, and participation, is the way we need to move forward, and it's excellent to see this, this exemplified here. And really, in closing, to commend everyone, each and every individual associated with the UNESCO Chair on Global Health and Education. Your work is not only, your collective work is not only an asset to UNESCO, but it's a contribution to our collective efforts to building a better world, a healthier, more educated, and sustainable world. So thank you very much.
Merci beaucoup.
Thank you very much, Sobi, for these very kind words. And you know how important your support is, UNESCO support is. And please also know that we are at the service of UNESCO, and we remain at your service, because this is indeed our ambition too, to contribute to the education and to health. So thank you for highlighting all of this. So before giving the floor to the French Commission to UNESCO, it is indispensable to remind us that all of this is only possible thanks to the mobilization of so many individuals at so many levels, and going beyond just Stefania Giannini, who wasn't able to join us, who has been able to support us and champion the fact that health and education are interlinked. We also had Christopher, who has been present with us all through this journey, and so many other teams, and there's also the commitment of each and every individual that has made all of this work possible. And what's true at UNESCO is also true at the French National Commission for UNESCO, which champions this project, which has been supporting us every day. And this is why it's a great pleasure for me now to hand over the floor to Suzy Halimi, who is in charge of the UNESCO chairs at the Commission, but also in charge of the French learning cities. Suzy, the floor is yours.
Madame ADG for Education at UNESCO, dear Mrs. Giannini, although she's only with us represented by Mr. Tawil, Mr. Director of the Directorate for the Future of Learning and Innovation, dear Sabhi Tawil, Madam Representative of WHO, dear University Presidents, ladies and gentlemen, researchers, teachers, good morning to you all. We are meeting here today to celebrate the renewal of the Chair, Education and Health for a new mandate. This chair is based in the University of Clermont-Ferrand, city that has joined the network of UNESCO Learning Cities. As it's a renewal, I would like, first and foremost, congratulate the bearer of the chair, Professor Didier Jourdan, and all his team. And I would like to thank him for his invitation, which gives me the pleasure to be amongst you today. When we say renewal, we say taking stock of the 4 past years, projects and perspectives for the coming 4 years. And I would like to say a few words on those 2 points, if you'll allow me. As person in charge for the French Commission of UNESCO, of the French network of our UNESCO chairs. We have 60 chairs in France, And I'm also in charge of the network of learning cities in France. Now, if we look at the 4 past year, Didier Jourdan's chair is remarkable in all the actions it did. It answers fully the ambitions of UNESCO and its priorities, and the missions given to all the UNESCO chairs, as they are entrusted with the development of cooperation at international level in the field of higher education and research. The file which we gave UNESCO to ask for a renewal of this chair is very rich, and I will not dwell upon it for a long time, but I would like to give you just a few examples drawn from this file. As of the beginning of its mandate, Didier Jourdan developed actions close to the heart of UNESCO as he worked on women's education in Africa, education to health, and training them to about health questions. You know that UNESCO has 2 major priorities, Africa and women. So this chair followed those 2 priorities from the beginning. During the COVID crisis that was so harmful for education throughout the world, the chair implemented distant teaching programs, MOOCs, for those who could not go to school or university. It developed seminars, webinars online, in addition to in-presence workshops and all sorts of other trainings that were proposed for participants. A professional license diploma with an impact, and we spoke about impact earlier on, with an impact at regional level, the region of Clermont-Ferrand, national, and way beyond at international level. Because the chair has established links throughout the world, in Europe, of course, with the UK, Germany, and other countries, but way beyond the borders of Europe. And I'm just giving you a few examples taken from the very long list of Didier Jourdan's partners: Algeria, South Africa, Burundi, Cameroon, China, India, Indonesia, and many more. When the Institute of Lifelong Education organized in Korea, in Yeonsu, in October of the year 2021, the World Meeting of Learning Cities on the topic lifelong health learning, we find Didier Jourdan in Yeonsu, of course, because of the expertise he has. And he is sitting there next to another colleague I would like to salute here, Philippe Boelet. He may be with us in the room. Philippe Boelet is in charge of learning cities for Clermont-Ferrand. And that day, the city of Clermont-Ferrand was awarded the title of Learning City of UNESCO. Philippe will take the floor tomorrow on a very important topic: how his city, how the different cities organize their policy to serve health. The World Conference of Yeonsu reached, as usual at UNESCO, a declaration, the Declaration of Yeonsu. And in this declaration, all the participants, the mayors of the cities that were present, and the representatives of universities, of NGOs, of the civil society, all those people committed to the Yansu Declaration in order to serve health and education, and education to health. And those commitments will be the backbone of the project of the Chair for the coming 4 years. And I will now quickly move on to my second point, projects and perspectives for the coming 4 years. The Chair, as should be, is based on research labs. We should not forget the importance of national cooperation in the field of research. So the Chair is based on research labs. It is linked to high-level institutions, and I can only give you a few examples. Amongst those partners, there's the French Society of Public Health, the League Against Cancer, and abroad, the Psychosocial Medicine Center of the University of Hamburg, the Medicine and Stomatology University in Russia, or the University of Surakarta in Indonesia. And those are only a few of those long lists of centers that work in the field of research and training. Now, for training, in order to be renewed, files should have an agenda for the coming 4 years. And I would have liked you to look at this 4-year timetable. We see in it symposia, workshop, international workshops and symposia on World Health, a World Congress on Public Health, workshops, symposia, and multi-topic symposia. And it is time for me to salute in the UNITWIN network a very close partner to Didier's chair, which is another French chair. It's the chair on sexual health and human rights. So all those different events have already been programmed for the coming 4 years. Now, how will knowledge share be organized? How will knowledge be spread? Because the purpose of a chair is to circulate the information, and as you know, UNESCO insists on open science. The chair of Didier Jourdan fits in this idea of open science. Several announcements for partnership were done, and knowledge information is done through the very rich network of French-speaking countries. I know that tomorrow you will be speaking about Francophonia, and I would like to salute here before you the director of Francophonia, whom I will see in a few days' time, because we will be covering the same topic for the National Day of UNESCO Chairs that will be organized next January. And I'm inviting you all to participate to this day, but it's a bit too early to give you more details. This National Day will have as a topic sport. And I do know that UNESCO insists of the values of sports and the sharing aspect of sports. And I hope that you'll be numerous with us during that special day. The results of the chair were remarkable, and I do hope that my presentation gave you a flavor of what they represent, and I have no doubt that the achievements of the next 4 years will be at the level of all everyone's expectations. And I do wish Didier Jourdan and all his partners, and you've understood that there are many of them, to succeed, and I thank you for your attention. Thank you very much for all those words, Mrs. Halimi, but I would like to say that for a chair such as ours to succeed, we need the support of the national network. So Madame Halimi and all the network is behind us and have their share in the success of our achievements.
Welcome everybody. On behalf of the University of Huddersfield as a new partner in the Chair's work, delighted to be with you today and so good to see so many friends here in the audience. It really lifts us up. I'm delighted to next introduce Chris Brown, who is the head of the WHO Europe Office for Investment for Health and Development and in the beautiful city of Venice in Italy. And talking to Didier earlier today, we were talking about Chris, and he said, she is a leader. Her focus is on meaningful action for equity. And we'd just like to say that we are with you. Okay, we're delighted that you have joined us to celebrate this second mandate, and please, we're very grateful for your address.
Wow, well, it's really great to be here, but I do hope that I meet your expectations. So, okay. Just to say, I really am delighted to be here on behalf of WHO Euro. I'd really like to thank UNESCO and the chairs for convening us here today. It's really an inspiring partnership, is the chair, in terms of how it's inspiring transformational change for better lives, healthier lives, leaving no one behind through health and education. And I have to also thank all of you in this room, all of you connected, and those working across the globe for the passion and the commitment to improving health and education systems so that they create better opportunities for everybody in society. But we have to also, I'm just seeing if this works. Does it work? Nope. Can I give this back to somebody to move the slides on? Yeah, can you move the slides on? Yeah, okay. Nice technical hitch. We're here to celebrate, but we're also here to look at what the future holds and that future direction, and I think we've heard some of that. This is really an analysis from the European region when we're talking to young, old, in different settings, what people want. And in fact, what people want today is to thrive, not just to survive. They want to live in healthy communities, but they want those communities to be safe. And they expect authorities to deliver public policies which secure a better life today and for future generations. Next slide. But this is the reality. And I think it's really shocking that within the European region, which has got some of the wealthiest nations in the globe, that we have 20% of the adult population living in poverty, living insecure lives, working but not able to make ends meet, having to decide whether it's a roof over their head or food on their table or education and employment. And so this is results from a study that we've recently produced on transforming the health and social equity landscape. And we can see that if we look to the right, we've got unrealized promise of the digital transition, with approximately 1 in 4 people not connected to broadband. 29 countries only provide 100% affordable services. And just to say in that, women, groups with lower levels of education, and increasingly in an aging society, older people, people over 65, are those who are missing out. So we have unrealized promise of that digital transition. We have all heard about COVID. We know, we've experienced it, we've lived it. We're now going through conflict, climate change, and cost of living crises. And what we see is that 40% lower trust amongst populations who are struggling to make ends meet. And these are populations who voted for governments that are in charge and who see other people benefiting from those government policies but not themselves. When we have a lack of trust, it starts to be the unravelling of the social fabric of society, and that is not good for anybody. And we see when we talk to young people, but their sense of not just what their actual resources are, but their sense of hope in the future is really low. And this is particularly so in young people who are struggling to participate in society, in education, and to be healthy. Recently, our analysis shows us that 64% of young people are suffering with poor mental health, anxiety, depression, fear. That's a huge amount. And just as a matter of interest, these figures, when we presented them recently to the European central banks, they were shocked at them, because for them this is not just a social and an education and a welfare issue. This is also about fiscal resilience and stability of the economy. But we have to talk about decisions that have been made in the past, based mainly on economic and profit models over people. And we can see that that has had fatal consequences. So in areas across the European region where there's been underinvestment in human development, that's education systems, lifelong learning, decent wages and employment, as well as in health systems, 600 excess deaths in those areas directly linked to low investment in human development coupled with low investment in health systems. So this is the reality. If you look to the left, how do we explain that? Economic development models focusing on profit over people. And that is also about profit now and buyback later. The trickle-down effect of inequalities, eventually everybody will benefit. It's not happening. The inequalities are growing. They're massive. Inequitable distribution of opportunities and resources. We see that in the unbalanced development example there. And an underestimation of the importance of public services and the need for trust in authorities to safeguard social and fiscal resilience. So where does that take us? Next slide. We know that health and education are the two pillars of human capital, but they're also the two pillars of social capital. And what's really needed to reorientate that, and where health and education partnerships need to focus, is on contributing to the need for a new social contract. And here we see Secretary General Antonio Guterres speaking at the annual Nelson Mandela lecture in 2020 about the need for a new social contract, transforming lives of people today and generations to come, and investing in 6 areas. Safety, where people live, and dignified lives, through policies that are anti-discriminatory and that give people the basic needs: food, shelter, employment. Investing in ways of working, policies and approaches, engaging people and citizens, so a sense of purpose and equal opportunities to prosper and thrive. That's through decent jobs, training, lifelong learning, but digital literacy and the way that we develop those services. Having a sense of control over our lives and influencing decisions that affect us. With 40% of people lacking trust in government, it's no wonder that political participation is waning. Education and health are key to political participation, and this is really massive today. This is a big challenge that we have to get to grips with. That links to having trust in others and institutions, so in terms of being able to reinstore faith that governments act fairly, therefore tax and fiscal policies that are fair in distribution of opportunities and the benefits of development, and to reverse the declining trend in social mobility. So the generation of the future in many European countries is now expected to be worse than the current generation. And that's not what the purpose of sustainable development was for. That means we need to invest in and measure beyond GDP The things we're talking about today, health and education, are global and public goods, as well as water, food, clean air, peace, and learning. And within that, we need to realize the digital transformation to benefit everybody. Next slide. This is what we're talking about, health and education being the pillars of shifting to well-being economies in terms of learning and appreciating the environment, managing their environmental demands in terms of being consumers, investing in lifelong learning, new types of learning, new skills that we need to live in society today, social capital, sense of mattering, belonging, peace, and economic well-being. Next slide. So how do we get there? And how is health and education, and how does the chair in this support this? Here are real examples that are working and are being applied. Here, universal basic income. And we know this from across the world. When people's basic needs are met, when there's no conditions of that, what they use that for is to invest in human, social, and education capital. And what we see here from our universal basic income analysis in Europe and globally is that where those policies are non-discriminatory and unconditional, then it's used to invest in health and education. So these policies have an education and health component to them, but they also have spillover benefits for that. Next slide, please. We talked about people who are left behind in the European region and globally. Men die earlier, have poor health. We talk about women's health. I'll come to that in a minute. But here we have in Europe, men's health is much worse. Seeking of behavior takes much longer, which means that interventions are less effective. So here, health and education are collaborating in the Men's Health Shed, which is part of the Men's Health Strategy for Ireland, bringing closer to those groups of men who would not participate in education, who would not attend primary health care, bringing those services closer to men in the places where they meet, and at the same time providing opportunities for friendship, for learning new skills, for employment, and voluntarism. And we can see that after 3 years of running the project, the impact on social literacy, 77% of the men participating had improved literacy, health and health literacy improved by 88%, education and employment also improved with learning, new skills, job seeking and employment. So here's the way that we reinforce how human capital through health and education are building better lives for those who are left behind. Next slide. It also means that the way we provide education and health services has to change. Here's a nice example from Poland, the Gdańsk City Hall Initiative, a social innovation lab for bringing young and old together to identify and address social problems that will make the environments that they live in, that they play in, that they learn in much better and more inclusive. And on the right-hand side, a new approach to providing services to ageing societies at the community level through a community neighbourhood initiative, Caring Neighbourhoods, where volunteers, health workers, city council, employers, older people together come together and identify what the health, education, learning and social priorities are, and the services are designed to address those. Next slide. If we go further east to the region, there's innovations in the way that sustainable development strategies are being built to rebuild trust. And this is a nice example from the Kyrgyz Republic of a new tax code, which has established incentives for achieving sustainable development that people in local communities, right in rural areas, can feel the benefit of straight away. And the investment and financing that has been generated, 40% of the investments have gone into improving work and economic opportunities for local people, 33% for reducing poverty and social protection, And we can see there that over 130 million in those tax incentives were assigned to SDG 3, good health and well-being, which was identified by the people of Kyrgyz Republic as their top priority for getting ahead in life. So seeing how tax is directly impacting on lives also promotes greater willingness to stay, to invest, and this is what we need. Next slide. Businesses are also picking up on this. And here we've got two examples. You're probably already familiar with the Preston model, which is where 20 local businesses, health authorities, education institutions came together and decided to purchase and spend 20% of all their purchase spending and employment in and around the local community. And in 1 year of doing this, what we found that the average wage of local people increased, 11% increase in that, 9% increase in life satisfaction, and we saw a reduction in depression. So what we see is that different ways of creating opportunities for people to learn, to participate in society, to be healthy, can be achieved by working in partnership. And on the right, Mondragon, you probably know from the Basque region of Spain. We may have some people joining us online or in the room today from this region. This is a model of employee-owned and managed companies, cooperatives, which has been going now for over 30 years. And is in addressing issues of health, human capital, lifelong learning, and it's actually proved that in 30 years, despite several economic downturns, the average wage and the poverty level in and around the community involved in this has not suffered and has bounced back quickly. I think I have 2 more slides. Next slide. This is the second to last slide. This is an example from Iceland. You probably know that in 2010 there was a banking crisis which nearly bankrupted the whole country. Do we have anybody from Iceland in the room? We're working really closely with Iceland, and they shared this information with us. After that banking crisis, it was a really tough time, and the government decided to invest in 6 goals: health, education, employment, gender equality, and welfare were the main ones, and fiscal accountability. 37 investment areas were linked to a well-being budget. Now we are more than 10 years on, and by investing in those things, they have an average annual growth of 2.4% of GDP. Unemployment is under 3%. They have the highest male unemployment rate in the world. Lifelong learning participation is also one of the highest. Gender equality measured by female employment and wages is one of the highest in the world, as is well-being. What's important to note about their approach is the way that they had public conversations and citizen-empowered legislation. This was through investing in community-based education and health programs. And we can see here, if I pick up the Fiscal Council, linked to the banking crisis, underpinned by a law. This is a group that involves NGOs, citizens, bankers, finance and health sector. And they act as an oversight on any investment made by Iceland has to be made in the interest of the health, well-being and sustainability of Icelandic people. And this is something now that is being picked up by many countries across the globe. Next and last slide. I want to say this because quite often when we think about health and education, we think about young people. We've got aging societies. And despite that we talk about the silver economy, in fact, the fastest growing rate of poverty and gender equality is in the older population. In terms of gender inequity over age amongst women for digital, but also in terms of the highest rate of homelessness now is among people 65 and over. And we know that one of the big issues here is investing in learning and training. And I picked up here some of the issues that are working around using digital solutions, around training, around education, around access to welfare and citizens' advice. So I think just to put on the table, as society develops, the need for focusing on that group is really immense. So thank you very much.
Thank you, Chris, and you didn't disappoint at all. That's fantastic. I will move on now because, again, we're delighted to have another colleague from WHO who has sent a video for us to play now. This is Rudiger Krech, who is the Director, Department of Health Promotion in the Healthier Populations Division of WHO.
Dear Ms. Stefania Giannini, distinguished guests, dear colleagues and friends, bonjour. It is my great pleasure to share a few words on behalf of the World Health Organization at this launch event of the second mandate of the UNESCO Chair for Global Health and Education. We are proud of the partnership that WHO has with UNESCO, the UNESCO Chair, UNICEF and other UN agencies, strengthened in recent years with an interagency group that meets on a regular basis to make every school a health-promoting school. With the UNESCO Chair being a WHO collaborating center for research in education and health, as well reflects the great synergies in our joint work to further health and education and its co-benefits. Science shows that health and education mutually reinforce each other. Every child, youth and adult have a right to quality education, health and well-being. However, millions remain out of school and lack basic numeracy and literacy skills. Many teachers do not have the required qualifications and are not adequately trained to teach and provide quality education. Crises such as armed conflicts, forced displacements, and health and climate-induced disasters are also affecting access to learning. Education is the foundation for building problem-solving, adaptive and logical thinking skills. It is also the foundation of health literacy. Health literacy is about the ability to discern accurate information from misinformation and disinformation, and utilizing it to make informed decisions about our personal health and to participate in collective health promotion action. Beyond providing information, knowledge providers and educators, such as ourselves, need to consider the context people live in, ensure information is sensitive and applicable to people's circumstances and experiences, and empower them to feel confident about making health-promoting choices. To create a sustainable and well-being future, and considering the destructive path that we are currently on, we need to challenge our fundamental operating principles. Our thoughts, assumptions, and actions are shaped by the world we live in and our experiences. Education helps us acquire knowledge and skills for critical thinking and encourages us to challenge and further develop our perspectives in health, our beliefs, values, and behaviors. However, not all education systems foster this, nor for the greater good. In this rapidly changing world, and to secure our health and the future of this planet, didactic approaches need to be adapted, taking into consideration what should be taught and learned, how and to what purpose and end. Important issues such as climate change will need to be integrated in the curriculum. For optimal learning and health outcomes, the settings which students and the school community interact with are crucial. Learners need to feel safe and healthy, be free from violence and discrimination, and have access to quality care services. Teachers need to feel supported and be given adequate training to deliver quality education. For learners to thrive, we need to foster the physical, social, emotional, and psychological conditions. And this is possible only with multisectoral action and a whole school, whole of government, and whole of society approach. Good governance for strong health-promoting education systems and visionary leadership are key to achieve co-benefits. Good governance is also key to building resilient systems. The world is currently confronted by multiple humanitarian, climate-related, health, economic and energy crises. To respond adequately and recover quickly from crisis, we need to build resilient systems, resilient social, health, economic, and education systems. The crises are not going away and in some instances may be increasing in frequency and intensity. To avoid the losses the world endured during the COVID-19 pandemic, investments need to be made to strengthen our system's capacities and capabilities. Health and education are closely intertwined. We need to work together to support the shaping of just, inclusive, peaceful, sustainable, healthy and thriving societies. We must also ensure we don't leave the vulnerable populations behind, especially people living with disabilities, indigenous people, refugees, and the rural poor. The work of the UNESCO Chair for Global Health and Education is critical, and WHO looks forward to continuing the collaboration with you and UN sister agencies to advance knowledge for health for all. I thank you for the opportunity to share and wish you all a productive day.
Thank you very much to Chris and to Rüdiger. And I'd like to repeat what I said earlier. We have another member from the Collaboration Center who is in fact a vector of the vision of this entire chair, and so I'd like to particularly congratulate him for his commitment here. And you'll see that on the WHO website, you'll see there's a very good piece on this event today. And I'd also like to thank Martin Weber, who's our focal point. Nothing can be possible without this very well-connected network of actors, and we're extremely thankful to all of them.
Well, it seems to me that getting up and moving was great. You're all ready to start the second panel of this launch event. We will start by giving the floor to the two universities that hold the chair. I would like to say that the chair is not an autonomous unit or body that hangs in the air and does what it wants, where it wants. We follow the policies of the United Nations, and our universities help us, and this is how we work. It is with the greatest pleasure that I will give the floor first and foremost to François Paquis, the Director General of the Services of the University Clermont-Auvergne, and whose support to the chair was unconditional since the first second. He knows all this very well. He was in charge of a French university for a long time and interacted a lot with the UN and other political players that support the work of the chair. François, you have the floor. I would like first of all to thank Professor Didier Jourdain, who was kind enough to invite me to take the floor in the name of the Clermont-Auvergne University. As an institution and as an individual, I'm very well aware of the importance of the chair. I was vice president for a long time of the French-speaking universities, and I had to take the floor in Africa several times. Thus, the topics of the chairs are very dear to my heart. The Université Clermont-Auvergne is very proud of this chair, which is very successful. The previous speakers have indicated that very clearly. There was a first mandate which was given to the university, and it was a full success, as we are inaugurating presently the new mandate for 4 more years. The University Clermont-Auvergne is holding this chair, Global Health and Education, since its creation, and it is very proud of the second mandate, which shows that the first one was a full success. And whilst preparing my speech, I knew it was a success, but listening to the previous speakers, I've understood that the operation went well beyond our hopes and that the link between education and health is very strong. And I thank Suzy Halimi for what she said earlier on. She says that this chair is very important because it has started working on educating African women to health questions. I was talking about that with one of you before this meeting, and I said that the first time I took the floor before UNESCO, it was as president of the University Paris Descartes that worked on the links between demography, education, health. And we insisted at the time on the fact that the education of African women was very important, as in order as not to leave them on the side, only busy making babies and raising them. So this chair, which is absolutely remarkable, as was said before, has amongst its main ambitions to contribute to social change, notably for young children and adolescents. And the COVID crisis really shed the light on this problem. We saw a backward movement because of isolation, because of bad health conditions. So the role of the chair there is very important. And it also contributes into the sharing of information in order to support new policies that aim at improving the health of populations, reduce inequalities, and preserve the planet. And all those expressions are all very important because the project of the Clermont-Auvergne University is concentrated on social responsibility, environmental responsibility, and our president himself is fully committed in the group France University on those topics. So we are not hosting this chair because it's something important with no link to the university's policy. On the contrary, it is fully related to our work in the field of training, research. We have laboratories that work a lot on the questions of development, and more specifically in Africa, but not only in Africa. We took note of the fact that the chair's action was to improve at local, regional, and world level the creation of a global community that brings together different players in training, in private, public companies, committed citizens in order to produce knowledge. And that is one of the characteristics of the university. Our teachings are related to research, so the production of knowledge. And in the COVID situation, the chair has contributed to scientific support in the drafting of policies and world recommendations of UNESCO and WHO on the way one should manage the pandemic at the level of schools. Now, in terms of capacity development, I was stricken by something particular. It was the launch of the vocational diploma in the Sheikh Anta Diop Dakar University in May 2022 that aims at reinforming the capacities of professionals in Western Africa, because sometimes in international policies tend to be going downwards, and they are adopted by local communities and local populations. And the fact that this vocational diploma organized at local level, which will train people on the ground, is very important, because the dynamic here is a participatory dynamic, and it's a co-creation program between all the local partners. Another strong point of the chair is to share knowledge. Share knowledge, communicate, inform, in order to create links between the scientific knowledge, the knowledge of the professionals, that of the communities, in order to develop health practices that fully respond to the population's needs. This chair is quite specific when it comes to the university's policy. It is an excellent spur for the people who work on health and prevention, while being fully embedded within the Clermont-Auvergne University. Of course, all the chairs of the university are embedded in universities, but sometimes their representation is quite small in terms of sectors. Here we bring together the different faculties: medicine, odontology, dentistry, education, and is at the same time linked to the Rectorat d'Académie, that is to say, the education management institution of the area. So the chair really covers different sectors of the university whilst remaining in contact with the city itself. It brings together the actors of education, research, practitioners in the field of education and health. It is a strong link between the educational sector, the research sector, the health sector at local level, national level and international level. And it also aims at facilitating international cooperation, North-South cooperation and South-South cooperation, and that is extremely important. Ethics and innovation are at the heart of its approaches. And it also aims at transferring knowledge in an efficient manner between research, policy and practice. It is linked to the three axes of the university: research, training and social responsibility. So in the name of the university, I wish full success to this second mandate, and as you have rightly said, the support of the university was full for the first mandate, and it will be as important during the second. Thank you for your attention. We did not know that several speakers were going to speak about the question of women and educating women in the field of sexual education. And for those that will not be here tomorrow, Fatou Diane, whom we have to thank, who has worked in this field for 25 years, and Abdou Limoges, who is also bearing an important network of community women in rural areas, notably for birth and pre and post birth. I give the floor now to Nikki.
Thank you, Didier. Well, now we cross the channel, and it's my pleasure to introduce Professor Bob Cryan, who is the Vice-Chancellor and Chief Executive of the University of Huddersfield. And reading Bob's bio, he's a distinguished academic. He's a chartered engineer by background, achieving high national honours with his Commander of the British Empire. But what comes through for me strongly from his bio is his belief in the transformative power and life-changing potential of university education for young people. It's also his pride in the University of Huddersfield, deeply rooted in his community, thinking global, acting local, and we welcome Prof Cryan and look forward to your address.
Thanks very much, Nikki, and thank you, Didier. Can I just begin with a big thank you? And that's a thank you to each and every one of you in the room and online for the work that you do. What you do is just really special. It's globally impactful. You change lives, and I think each of you should be very tremendously proud for that. So I'd like to just start by asking you to give yourselves a round of applause, please. Now, my invitation to this event was unusual. You got to picture it. I was wearing a Christmas hat and I had a bottle of wine in each pocket. And Didier and Nikki asked me if I'd be prepared to come along and present today. And given what I was wearing at the time, I felt obliged to say yes. So it gives me great pleasure to be here to officially launch the UNESCO Chair in Global Health and Education. And the University of Huddersfield is honoured to be a partner, and I'd just like to pay a tribute to Francois and his team at the University of Clermont-Auvergne here in France. This new collaborating centre will create a hub for global health and education at the University of Huddersfield. The focus of the work is on the collaboration of professionals in healthcare, public health, business, social care and education to support people across the life course to attain and maintain their best possible health. This lifelong learning about health starts in infancy, continues through formal schooling and extends throughout life into our older community. Health and education is mutually reinforcing. Students need to feel well to be able to learn and to achieve their best possible educational outcomes. It's hard to concentrate when you're hungry. In turn, students who get a good education tend to have better health outcomes, not least because they've got the means to find a decent job and home and support their family to do the same. At the centre of a successful lifelong learning for health is a group of professionals in health and education who are committed to this mission and to their communities. Our university recognises the importance of research-informed, high-quality training of these professionals. We recognise the importance of providing our teachers with the tools they need to look after their own well-being in order to equip them to teach and nurture our children and young people. We know that our health systems and schools are suffering from an exodus of highly trained people who, quite frankly, are worn out and demotivated after the impact of the pandemic. In both sectors, we see that the only way to secure a bright future for our children, young people and families is to put well-being at the centre of everything we do, and that starts with the way we train and value health and education professionals. As a university, we're committed to knowledge production and sharing, and this new collaboration will provide us with more opportunities to expand on the globally relevant research we already do. We're investing £100,000 each year for the next 3 years into our new UNESCO Chair Global Health and Education Research Group. Our vision is a self-sustaining, long-term global centre of excellence. By bringing together different disciplines across the university to share their areas of expertise, we can work together towards a common goal of sharing knowledge and building capacity by developing our early career professionals. This multidisciplinary approach maximises the opportunities for research at Huddersfield and with our international partners. Our university is proud of our contribution to the building of international research capacity. We now publish with 97 of the top 100 universities in the world. I'm delighted to see that one of our current PhD students, Somto Chike Obu Akeye from Nigeria, is shortly going to talk about her involvement with the UNESCO Chair. Somto recently won an international award for her research about the contribution of community pharmacy teams in suicide prevention initiatives. She shows exactly what our international collaborations can actually achieve. For those of you who are not familiar with Huddersfield, we're located in West Yorkshire in the north of England, an easy commute to nearby Leeds and Manchester. Huddersfield is a vibrant and exciting town with a diverse population, and the university is right at the heart of the town centre. We have nearly 20,000 students from over 100 different countries around the world, and we contribute to the cultural welfare of our town, in addition to providing learning and employment opportunities. We contribute approximately £300 million per year to the local economy, and we're one of the largest employer providers. As well as being known for our strong industrial heritage, our Huddersfield hospitality means that we are actually one of the friendliest places to live. And I say this as a local resident because I was born and bred in Huddersfield, and I hope that you agree I'm a friendly person. It's a particularly exciting time for us right now, as the region we are located in, Kirklees, has recently been designated as UNESCO Learning City. As a university, our raison d'etre is learning, and this will provide us with some fantastic opportunities to work with the community. We'll also be able to learn from and with UNESCO's global network of learning cities. The university has helped put the town on the map with our commitment to global health and education, and indeed we're building a brand new National Health Innovation Campus and investing £250 million in that to train the next generation of health professionals. This transformative project will improve health outcomes and lead innovation in healthcare for the north of England, the UK and internationally, and will enable the rapid expansion of courses in nursing, midwifery, allied health professions, leadership and human sciences. So we're well placed to respond to UNESCO's challenge through this new mandate. I look forward to seeing the many exciting possibilities of this collaboration turn into reality and the many benefits it will bring to the wider global community. And once again, I'd like to say a big thank you to Nikki and Didier for inviting me to be part of this launch event. I wish you all every future success. I genuinely mean it. What you do transforms lives, and you really should be proud of everything that you do. Thank you very much, everyone. Thank you.
Thank you very much, Bob, and we are happy to be with you with or without the Christmas hat. So now I would like to say that it's the most important change for the second mandate. Now there's 2 universities. The idea is to co-host our dynamic department of a pharmacy, so it is the healthcare side and the education side directly connected to the other faculties who are involved here in France. So this is for us something that is probably one of the expressions of where we are. We are intersectoral by nature. Alors je voudrais maintenant donner...
I'd now like to hand over the floor to Cyril Isaac Sibily, MP, Member of Parliament. It was important for us to give the floor to the person who personifies the transformation of public health in France on the political level. So Cyril Isaac Sibily is in charge of prevention in the health sector. And for the chair, it's important to interact with all of the social actors and to also look at its capacity to influence social actors and to establish dialogues with political actors, with policymakers. Cyril votes almost every day, and this is a major issue for us, that is to be able to contribute to a policy. And so, Cyril, the floor is yours now. Thank you. First and foremost, like my colleague here, I'd like to also congratulate all of you for the renewal of the chair's mandate. And thank you for giving me the floor. As Didier said, I am a doctor and I am MP, and I work on a daily basis to improve our health systems. We are a rich country, France is, but we still face many difficulties in the health sector. Healthcare has never been as abundant as today, and despite that, our system faces many challenges. And why is this? Well, this is because we have an aging population, and illnesses are becoming more chronic than ever. We realize that 20% of chronic illnesses are responsible for 80% of expenditure, and so the expenditure is growing. And so you see that that's a huge problem, and that's why the system in France is trying to adapt to this new problem. And our system in 1945, when the social security system was created, there was a promise that was made to the French population, i.e., when you're sick, we will take care of your health expenditure and take care of the services. And that also implied that irrespective of what your behavior is, we'll take care of you when you fall sick. And it's true that to change all of this, we need political will, but even at the political level, we need to raise awareness among deciders, policymakers, in order to create this change. We need to go from individual care to a new promise, i.e., we will take care of you, but at the same time, we're going to try and get you to adopt a behavioral change that's necessary. And so I'm so happy that I was invited here by Didier, because I think there are two major injustices in France as well as across the world: education and health. In France, we have two systems. We spend 250 billion euros every year, and education is the leading budget of the country. And despite these huge funding, there is a problem in both these sectors in France. And this is why the most important thing for me is to be able to have education at an early age, to be able to have healthy habits. And I thank the chair for this. I thank the Clermont University, because it's thanks to this chair and thanks to the university that we in France have been able to set up an intervention that now reaches 10 million children. And through this initiative, we have a health diagnosis for these 10 million children. And this was done through the administration of questionnaires. And then we trained the teachers in schools, and we gave them practical tools so that they could tangibly work on psychosocial skills and health literacy. And this, again, I'm repeating it, thanks to the university and thanks to this chair, we've been able to estimate all of these children, and irrespective of where they're coming from, their backgrounds, whether they come from well-off backgrounds or poorer backgrounds, whether from cities or rural backgrounds, so that all of them can develop their health literacy skills. And so there is a need for political will for these kinds of initiatives. And this experiment was called an alliance. And that's because we need universities to participate in these kinds of endeavors, because you work on the tools that we then try to apply on the field. And that's really crucial for me. And it's also called alliance because we've been working with health agencies in France and with departments that are in charge of managing universities. And so in this way, we've been able to bring all of these actors around the table and thus establish this cross-cutting initiative. And as a politician, I'm learning lots of things thanks to this initiative. Education is important, but you also need to change the environment in which education takes place. And of course, that's also something that we're working on. And at the Parliament last night, I had two successes in terms of encouraging industrialists to reduce sugar content in sodas and in ultra-processed foods. Well, we haven't fully won this battle. It's really interesting, and I think it concerns the entire world, because very often you have conflicting interests, and that's why we need you, we need the university, we need the chair to move ahead. And so I wish you all the very best for the second mandate. Thank you very much.
Merci beaucoup, Monsieur le Député.
Thank you, Cyril. As you said, the interaction between those who produce knowledge and those who contribute to social transformation is something that brings us all together. And the alliance that you spoke about will be, in fact, mentioned in many publications that are going to be emerging soon. And I'd like to mention the Collège Jean Monnet and Franck Chevin and Karine Sima and Philippe Curie, who've been champions of this mechanism and who are going to contribute to enriching the knowledge base. And the idea, of course, was to work towards health equity. And because we're talking about commitment and health equity, let me now give the floor to the president of MGEN Group. For those of you who aren't French, MGEN is a mutualist group, which is part of a larger group called a VIV Group. And they have an approach that is centered around insurance, around prevention, and around care. And prevention is at the heart of all of this. And this is the reason why they're part of the founding partners of the chair. And I'd like to say that the commitment coming from insurers is also a commitment from the entire organization. The VIV Group actually has 10 million clients, and I do not want to anticipate what Matthias would say. This means that we will be able to structure the production of knowledge, and this knowledge will be operational. Thank you very much. Matthias, the floor is yours. Thank you very much, Didier, for these kind words, and good afternoon to everyone. I am delighted to be here with you to continue on this adventure that we've embarked upon with the chair, founded on the values that we share, and that it builds on a long-term partnership with MGEN and VIV Group. This chair brings together two major elements that are values that are dear to MGEN: commitment to progress, social progress, and health for all, and we're collective mutualists that aspire to take care of each and every individual all through their life. And this is an ambition that we wish to achieve by putting people's interest, individual health interests at the heart of our actions. And so this means that we're not just insurers, we're also providers of care that ensure access to healthcare for everyone all through their lives. And our foundation, since its creation in 2008, also welcomes the chair, and this facilitates collaboration and the publication of work when it comes to methodological issues on health promotion, or to organize discussions that bring together the themes of education and health. MGEN was founded by teachers and for teachers, and thus bring together two pillars of our society: education and health. So health of our teachers and education personnel, but also all of our subscribers all through their lives. And so you can see very clearly the link between education and health. It's a field that we work in every day. And thanks to the works done by our foundation, we can measure the proportion of subscribers who have never consulted a medicine all through a year. We have some very interesting figures. For instance, between the ages of 0 and 9 years old, the same proportion of girls and boys that do not see a doctor. So no medicine, no doctor seen from ages 0 to 9. And then from 10 years onwards, boys consult doctors lesser than girls do. And so on and so forth. And then this shows us that individuals must be actors of their own health, and that support must be given to them. We have, for instance, figures from 2022 from Dr. Lib. 77% of doctor consultations are done by children, for children, and 81% for women. And there's another issue. Women's health shouldn't be reduced to just gynecological health and reproductive health. We have to look at the major differences so that these differences related to sex do not become gender-related differences. There is a real taboo when it comes to women's health today, so we have to fight against that. And so all of this shows that for us at MGN, it is important to conduct research work and awareness work. We have proof now that education and health are major constituents, determinants of public health. And I thank the chair for taking up this topic. But beyond my role as president of this company, I am also a teacher, and I therefore cannot talk to you today without bringing up the fact that a few days ago, our country, our educational community was once again struck by barbaric actions. The hour is a very sober one and a very moving one, and all communities, educational communities, are moved today. And we have to recall that the school, the public school in the Republic, works for emancipation through knowledge. So we're moved, but we're also very angry. These past few days, I've been reading opinion pieces on the best profession in the world, that of a teacher. And this most beautiful profession in the world is something that comes up in our minds only when someone dies. And very often, at other times, they're criticized and they're denigrated. There are so many cliches around this profession. People say that teachers have too many holidays, and that we often forget to mention that they're not the best paid among the workforces, that they don't have enough resources to conduct their jobs in proper conditions. And very often, people ask for more public service, fewer taxes, more education, but fewer teachers, more medical care, but fewer social service contributions. So at this point in time, we have to look at where we are exactly. Our society is a society full of emotions, but we're also in a society full of lobbies. We have to work towards a collective project where public service, schooling, secularism are all the cement of our society. I fear that once we move beyond this period, once again we forget what is essential, and we'll work against, once again, the people who work for knowledge. And this is something that we have to stand against. And this is why at MGEN we consider that the health of teachers will enable those who develop knowledge that train the citizens of tomorrow to be protected physically and psychologically. That's because we have the responsibility of training tomorrow's citizens, our leaders tomorrow. And we need what it takes to train them to become responsible adults. And that's why we work towards favoring quality education where teachers can benefit from social protection, because this is a major lever of our citizenship. Thank you very much. Thank you, Matthias, for this statement that you made that echoed the statement made by Goof earlier. We're committed on the social level, and these are absolutely things that move us and that make us move forward in our mission. once again, I'm going to remind you that there is no chair at UNESCO if there is no foundation from the MGEN Foundation, if there is no close interaction with the University Foundation. Matthias just mentioned the barometer on teachers' health. Other colleagues here are working on similar projects, and so all of these represent major pillars of our activities.
This part will be more about the work of the chair, the UNESCO chair. And Nicola, I would like to give you the floor to introduce Somto, please.
Thank you so much. Well, the next series of presentations is very dear to the heart of Didier, myself, and the whole team, because one of the things that we brought out very strongly actually in our application for the second mandate, but indeed was going on through the first mandate, was the importance of making everything sustainable about the chair by giving opportunities for the leaders of the future to be able to play a centre role. And indeed, those of us involved in young people's health, everybody in the room, you know, sort of thinking about youth being and their voices being at the heart of everything that we do. And so it gives me the greatest pleasure to introduce Somto Chike Obuekwe, who is a PhD student with wonderful supervisors at the University of Huddersfield, and I'm not biased at all. And Somto came from Nigeria to the UK to do studies around the contribution of community pharmacy teams to suicide prevention initiatives, because Somto, like myself, is a community pharmacist by heart and background, and her work has already drawn international notice, and it's an interesting context to work in on a subject like suicide. So, Somto, the floor is yours, and we're so glad that you could be here with us today.
Hello, everyone. I want to say thank you to UNESCO for giving me the opportunity to speak today. It is an honor to sit in front of a wonderful, diverse group of professionals trying to make a better world for us youth, for the future leaders. Thank you, Nikki, for the introduction. Nikki is my wonderful supervisor, and I'm from the University of Huddersfield. I have had the privilege to attend 2 events by the UNESCO Chair, and the first event was on building a community resilience in time of crisis. My role during the event was to be a facilitator, which I was kind of a bit scared, but during the event, my confidence level was built, and as a researcher, I learned a lot. It had a great impact on developing my skills as a researcher and in a way of communicating with people. And we also looked into what community is and the role of community health workers. And part of the things that was developed was communication, education kept on coming up every time among the group that I was facilitating. It also made me to look into the role of community pharmacy, especially during the COVID-19 pandemic crisis. I was in the UK, but a lot of community pharmacy in Nigeria was open back then, and it was really accessible to the whole population. But the thing is, because of lack of education and lack of, when it comes to the mental health aspect in Nigeria, it's highly stigmatized. So the community pharmacists couldn't actually do a lot. But I actually had to learn from different countries on the way that they managed during COVID-19, especially when it came to communicating with the community, working hand in hand with the government, which is something that we actually lacked back home. And it was something important for me as a researcher to look and explore more on the role that we community health workers could have to the community. And actually also things that were highlighted was building relationship among the community, the stakeholders, and the policy makers, which is something that I find passionate about, especially when it comes in changing the curriculum of pharmacy schools, incorporating mental health education into pharmacy schools, and looking into the mental health well-being of the healthcare workers. And the second event we looked at the sustainable community-based practice solution for the challenges of today. And the thing that was actually really, really picked out was environmental safety, food security, and mental health. And when you look at these things, they're all linked together. If the environment is not safe, your mental well-being is affected. If there's no food safety, especially in terms of poverty, your mental well-being is affected. So the speakers highlighted on how we could create impact, on how we can create changes in creating environmental safety, food safety, and the mental well-being of each individual. And when you look at that, education actually comes into play, because a lot of things were done based on research and evidence-based, and doing the facilitating, doing the workshops and the group meetings, my group actually explored on how the community can actually have an impact in the environmental safety, and the role I, as a community pharmacy, could have to the community in establishing an environmental safety. And also, part of the things that I'm actually pleased about, apart from being a pharmacist and a researcher, I'm a youth. We make up the 16% of the population. We are the future of tomorrow. And if we are properly educated, we can create changes. It's not just by being in a room. You could have an impact just on one individual. And looking at this great group, I can actually believe that my future is secured, and I want to thank the UNESCO Chair for this wonderful opportunity in including the youth at the center of every conversation, and including the youth in all the decisions they are making, and also incorporating health and education, because it truly does have a link. If you are well educated in terms of safety and prevention, the world could be better, and we could create prevention efforts for the world. Thank you very much.
Thank you so much to Zomto for starting off this section about our young professionals, and I must mention our good colleague Hayley Gorton, who has been steering Zomto as main supervisor along her way. I believe now that we have a series of videos that will be played. We're looking forward to those. Thank you.
Hello there.
Yes.
I am Vasilis
Thank you.
Belli. I come from Greece. I'm just 19 years old. Last year, I had just graduated from high school. I think the main highlight of the first mandate of the chair was that they actually gave us space and time to express our thoughts, how we say things, what we have to say, what our problems in general as a youth community, and not just in Greece, but in pretty much all over the world. I was implicated in the International Association for Adolescent Health for the European Regional Conference. It was great, quite insightful. During that conference, many events took place, such as about climate change, for COVID crisis, for mental health and health in general. During these days, we had plenty of time to discuss with every speaker, with every participant, and we exchanged ideas, some thoughts, and I was really, really happy and lucky to be involved, to be there. I had people to guide me, like Mr. Jordan, like Mrs. Pokalamu. It gave me a boost to be not just confident, but express my thoughts, see that so many similarities. It really helps you mentally. How we could propose ideas, changes, how it is really necessary for every government, not only in Greece, but in any country, in every country, to take seriously mental health and include it in the term health in general. And it was really good to see how they work, as I said before, how they take actions. And I'd like to express my gratitude to Miss Titika, Miss Panaguli, Miss Bumba, Mrs. Gray, Miss Baldak, and Mr. Jordan, Mr. Breda, those, because not only they gave me that opportunity, that chance, but they even encouraged me to be more involved, to take more actions, to speak more, to be more myself, relaxed. And last but not least, I'd like to thank my fellow youth participants, because I was really inspired by them. I really took an example out of them, and they gave me that boost, that confidence to speak. We had some great time together. There were some pretty good leaders with me there.
Bonjour, je suis Chloé Vérité.
Hello, I'm Chloé Vérité. I'm a project manager in the field of health for health prevention for students of the University of Rennes and Rennes 2, and we also work with about 10 higher education establishments. The contract with the state, I was lucky to collaborate with the UNESCO Chair, and I gave my logistic support, organizational support, and I helped also in communication during the seminar on the renewal of the epistemological and ethical framework of the promotion of health in order to reorganize the area of work, adding more players, more knowledge. And during the event, I was lucky to meet Nicola Gray, that has encouraged me afterwards to present my candidate to be the young French ambassador of the International Week of the Adolescents' Health, and to become after that a senior ambassador to accompany young people. And this was a real boost and a very enriching experiment, because I was able to meet a diversity of young people who came from the world over with different health problems, depending on the environment they lived in and the country they came with. But we all came around common values, that to fight against social health inequalities that are implemented as of a very young age. And we all wanted to be actors in the health sector. We did co-construction, and this is where we understand that a community such as the Chair allows to bring together actors to do intersectoral activity, which is very important. As young professional in the field of prevention and healthcare, I identified different challenges. First of all, the lack of knowledge with regards to health promotion outside the health sector. And some people outside the health sector do not understand that their actions have a different direct linked to health and the health of youth. So we have to use scientific data. We have to use specific tools to have a solid base of proof to show everyone how their participation is important. The second challenge is the necessity to analyze and take into account the schools from kindergarten to university as important areas. There are different health elements related to the school system on which we have to act, and it is our responsibility to do so, to accompany the young people. And another challenge is to give more visibility to our sector by giving more time and work in the field of human resources to help the different stakeholders to work with the young people. And I do hope that the second edition of the Chair will be as pleasant as the first one.
Hello, everyone. My name is Kennedy Sigodo, and I'm based in London, the United Kingdom. I'm a lecturer in public health and a health promotion professional. During the first mandate of the Chair, I was involved in two events. The first event was the school reopening interviews, and the second event was the 12th World Congress on Adolescent Health. For the school reopening interviews, my main role was interviewing education and health professionals on their experience and perspectives on safe reopening of schools. I also took part in transcribing the interviews. During the second event, and that's the 12th World Congress on Adolescent Health, I did a presentation on involving adolescents and basically adolescent participation in public health interventions. The first event about school reopening interviews gave me an opportunity to contribute to the global efforts in addressing some of the issues that were arising from the pandemic, specifically ensuring the schools could be reopened. Because at that time, there were certain countries that still had not reopened their schools. And it was based on our efforts that they would get the necessary information required to make the decision whether to reopen or not to reopen. Also, both events had a link with adolescents, and this was important for me as I was undertaking my PhD students on adolescent mental health at the time. Therefore, I had a keen interest in issues affecting adolescent health and well-being. Taking part in such a global project enabled me to acquire key transferable skills as a researcher. And as a public health professional and adolescent health enthusiast, I began thinking about how my research could solve issues such as adolescent mental health that was being anticipated to be one of the aftershocks of the pandemic. And so I began shaping my research to provide some of the solutions that would be needed to solve some of the issues arising from the pandemic. The second event, that's the 12th Congress on Adolescent Health. It provided a forum where I shared my ideas on how adolescents could best be involved in interventions that affect them. During the first mandate, I had an opportunity of working alongside other researchers, and I had an opportunity to meet the chair at that given time. And I believe that being involved in the first mandate provided me with useful professional networks that I've kept till now. So mine is to wish the chair and everyone involved at UNESCO Global Health and Education all the best in the second mandate, and I look forward to further interactions with you in your next project.
So thank you to the young professionals who have contributed, Somto being here in person. It's a great pleasure to have you with us. And all the interviewees also, thank you very much. And Catherine Chabot, who worked a lot on getting these interviews ready. And now we're moving to the last part of our meeting, which is basically about the work that we do as UNESCO Chair. And I have the pleasure, first of all, to introduce Professor Nanne de Vries, who is sitting right here, there, actually. And Nanne is professor in health promotion. He's emeritus professor nowadays at the Maastricht University. And Nanne was brave enough to step in our adventure from the start. And he's member of the steering committee. He's actually head of scientific affairs for the UNESCO Chair. And Nanne, I give you the floor.
Well, thank you, Grove. I'm very happy to have these 5 minutes. You can see I'm not a leader of the future, and that's why I'm an emeritus. But it is an honor to have been working with these people over the past few years, trying to support knowledge production, also knowledge sharing, of course. I'm so impressed by the number of activities that have been done, and I'll tell you a bit about that. If I could have the next slide, please. I think one of the most important accomplishments is in this map of the world, because everywhere where there's a shade of blue, it means that there's a contact or a partner of the chair, which means that it is a global coverage, almost, well, it's not all countries, but there are many, many countries, and the more blue the shade, the more intensive the collaboration. And France stands out, of course, which is probably due to DJ being on board. And I think that England then will also become a bit more blue, but that's then thanks to Nicola. Nikki, I hope it will not be as blue as France is at the moment, because that is really a bit skewed. But anyway, so Huddersfield will bring us to England as well. And I was asked to present some of the highlights of the work that has been done. Now, which seems a bit silly after I came in, because I saw this brochure. And in the brochure, there is the 10 spotlights with also some examples of the projects that have been done. And actually, if you want, on the last page, later when you're home, you could scan this little thing, and then you'll see all the projects that have been done. But anyway, I have 5 minutes of fame, so I'll go into it anyway. And this morning we had a steering committee meeting, and there was an overview of all the projects that are running at the moment. And I can tell you there were more than 30 projects that were on the list, which again attests to the high level of activities that the chair is producing. Now the 10 spotlights are organized, and these are the first. I'm not going to read out all the text on my slides because you can read faster than I can talk. Of course, these 3 spotlights are very important for me as denominated head of scientific affairs, because this is about conducting research, producing knowledge, and also sharing that knowledge. And I think it would be important to share with you that it is not only producing knowledge in the traditional ways, but that we are really working on the epistemology of producing that knowledge in the context, of course, everything of promoting the SDGs. I put my UNESCO thing on. You can all buy one in the shop of UNESCO later on. It is about production, and it is about sharing. And I firmly believe that, just science for science, of course, it has some value, but it becomes, at least in health promotion, more important when we share the knowledge with people. Oh, this was actually already the... here are the examples of some of the products that came out, and you can see there are scientific publications, but there are also more, let's say, popular publications. And I would like to point out the Global Handbook of Health Promotion Research, which is on the lower panel. There are 2 volumes now, and I can tell you there's 53 chapters in volume 1. There's 27 chapters in volume 2, which is a bit smaller and also a bit less expensive. But again, it attests to, involving the whole community, the global community, in producing this kind of work. So I think that's very important. Could I have the next slide, please? Because then we go to the next spotlights, which is about social change for health. And of course, health promotion is about social change. We have heard lots about this already, and I think community engagement is then, again, a very important aspect of that. And indeed, that is what the whole endeavor of this chair is about. So could I have the next? You've read it, huh? So we could go to the next slide. This is the support that we give, and I think importantly, again, the Yonsu, I don't know how to pronounce it actually, declaration is there, so the learning cities. I think it's an important aspect that we need to share with you, that the chair is very active in that, and that we are extending to healthy aging projects as well. So could I have the next slide, which is about the capacity building? Well, you must have gathered by now that we find this very, very important. Setting up training facilities, supporting schools in developing their resources. And the highlights are on the next slide. And you can see that in Dakar, Senegal, there was the chair supported the development of a professional degree for health education and promotion, which now goes into its 2nd year of enrolling people. The first year was very successful. I think now there are about 25 or 30 persons enrolling in this program. Kiduli is about oral health, which is in France itself, and many, many MOOCs that you could also use. And this is, of course, a very important aspect. This is not me doing this, huh? Just to be sure. Well, I'm called... Could I have the last slide, please? I'm called a critical friend, and that is because I'm the one who always steps on the brake when needed, and also advise not to do things yourself only, but indeed delegate it to the community. The community is not there for nothing, and so, the chair is us, actually, so we should develop that. And the next step for me was in talking to other people, develop the research strategy for the next few years, and develop an action plan to do knowledge production, knowledge sharing. And I think with that, the chair has a bright future ahead. I'll try and contribute to that. And with that, my 5 minutes of fame has gone. Thank you very much.
Thank you very much, Nanne, for your, as always, inspiring words. And it's great to have critical friends, isn't it? Like Nanne, it's a pleasure. And I would like now to introduce DJ. How can I introduce DJ Jourdan? Everybody knows him in this room. I know DJ actually from about 2007 when we met for the first time in Montreal, of all places. It was a wonderful occasion, and it was a wonderful marriage of thoughts and synergies. And we didn't realize that we would end up working together in this project with the UNESCO Chair on Global Health and Education. And it's not only a good colleague, it's a good friend. And yeah, when we meet, there's always something happening, I would say. DJ, the floor is yours.
Thank you very much, Rolf. So I'm sorry, before speaking, I would like just to tell Nanne that you did what I want to do, because the second language lesson, the first one you remember is the chair is you. Now, this is the chair is us. La chair, c'est vous. So the same exercise, please. The French-speaking people, that's your turn to say the chair is us. Okay. And the English people, the English-speaking people, la chair, c'est nous.
The chair is us. We are the chair.
Thank you very much, Rolf, for this kind introduction. My role today is to set the scene in 5 minutes, just to say where we are going. We know, pardon, excusez-moi, donc de dire.
To tell you what the project of the chair is for the years to come, following what Nanne said in terms of what already has been done. So later on, Nicolas will take the floor. Both our visions, well, I'll talk to you about the vision, and Nicolas will talk about the operational front on how we're going to make this work. I think it's useful to take a few minutes to recall what exactly we're talking about, where we're headed, and how we're going to do it based on scientific knowledge, professional expertise, and capacities and knowledge from men and women who are on the field. So 3 pillars to what I want to say, which in fact constitute the vision that is going to move the chair and which will move the chair for the next 4 years around creating health for all, around change, social and environmental change in favor of health, and how to set up production and sharing of knowledge in a favorable environment.
First of all, this is self-speaking for most of you. We are in an evolutionary perspective. That is to say, we are not saying this or that behavior is good and this or that is bad. This health problem comes from something that's natural, that just happens to those populations. No, this is not the topic we are covering. Everything we cover within the chair are problems related to dynamics, and those dynamics are linked to evolutions. I'd like to remind you that we evolve by the day. Psychologically speaking, socially speaking, anthropologically, biologically speaking as well. Since we know how our genome is expressed, we know that we change very quickly. But because you had several vaccinations, you know that COVID also changes very quickly. Your behaviors change, advertising changes. So the key is evolution. And the interaction between each and every one of us, the populations with the social and biological environment. We should not be mistaken. We are not crusaders that are facing an evil. We are in a situation where, for a period of time, for such and such a social category, such and such a population, things will not there will not be an adequate a proper link between the people and the environment they live in. If there is no advertising for McDonald's, Coca-Cola or Kinder, for instance, of course the behaviors will be different. So what is our topic? Our topic is to accompany social transformation. As the Member of Parliament said earlier on, it's like the English example, the sugar tax. We have to increase people's capacities. So we know that our topic is to target social and environmental transformations, because the real challenge is inadequacies linked to the evolution of our environment, what we are. You all know the typical example, that of the inhabitants of the Tonga and Fiji Islands, for which 85% of the population is obese, just because those people crossed oceans with an optimal metabolism to survive with very little resources, and the day food is plenty, there are consequences on the metabolism. So my question is not to say what's good or bad here. We have to recognize that our world is evolving constantly. Your work, our work, is to orient people in favor of health and reduction of inequalities, and do that in the field of social and environmental questions. So this is translated by major changes, and we have to adapt as individuals and as a group, and we will adapt. What's the role of WHO, UNESCO, the chair? Well, their role is help a fair and inclusive adaptation, because those are the biggest assets adapt very quickly. Now, how can we guarantee that we adapt as a group? Which leads to the concept of resilience and the importance of resilience in the public speech today. So once we've set the framework, we have to work on the visible determining elements of the situation. That's not enough. We don't just look at the tip of the iceberg. We have to look at the whole iceberg. That is why we need a sectorial policy, and we have to activate the three levers, the main levers for the creation of health for all conditions. We have to work on life ecosystems, the development of literacy, knowledge of population, and access to health measures such as prevention, medicine, and searching for potential diseases. So we have to accompany social change. There are only three levers, not more, to accompany the social change in favor of the health for all, good health for all.
Good. So we have to come back. Okay.
So, to get back to that, how can we act on those three levers? For that, research is necessary. Collecting information on people's practices is also essential. And what we know is that to act efficiently in the creation of good health conditions of people, you have to start by knowing the people. Then you have to look at all the elements that have a consequence on their health. And then you have to be able to bring together all this knowledge. You don't look at people's health without the people, and you don't do people's health against them. And then you have to work in a strategic fashion, and this is where there is a transversal element. If you only impose sugar products, it's not sufficient. Or sweet products, it's not sufficient. You have to develop the skills of citizens by teaching them how to take a step back when there is advertising. And you have to teach them what are the good way of creating a healthy diet. And all this has to fit in an ethical horizon based on the trust into the stakeholders to be themselves decision makers capable of taking care of their own health. So the next mandate of the chair, taking into account all those elements, will activate the three levers. And I would like to do a bit of advertising for tomorrow. Tomorrow we will be introducing 8 initiatives, all related to the way they act on health elements, with the support of the partners and the chair. But anything we do is done within the framework of a partnership. And then you're going to tell me you're not telling us whether you're a promoter, preventer, teacher of health? Well, that's not the topic. What is important is to look at the way you design your approach. Our approaches are designed based on our vision. Some were born in the south, others in the north, others within the health environment, others with social workers. So whatever the approach you choose to decide, the UNESCO Chair works on the prevention of diseases, promotion of health, and education to health. So people design what they do, but you must also start from people, from the elements have an incidence on their health. You have to use the knowledge and you have to try and emancipate the people. And education is the central axis around all those elements. And education goes from 0 to 120 years of age. And you showed very clearly that education, even of people over 75, had a consequence on the number of people that go to hospital, on disease evolution. So we have to create value, to pull the elements and increase by bringing scientific knowledge. So this is the chair. It's a lever to reach the objectives. It's built for that, elaborated for that, an ecosystem of production and sharing of knowledge with the community and with representatives, stakeholders from the associations, mutual associations, cities, communities. So this effort is an epistemological effort to produce useful knowledge, useful for our action, notably. Those are social transformation procedures and a procedure to change the skills and capacities. So the big challenge, knowing that the approach is ecological, it aims at orienting the social and environmental environment. So it concerns us, human beings, and all the people of the planet. And we now have to concentrate on the three levers of creation, health for all, whatever the approach adopted, and do it as a collaborative effort. So what do we do for the next mandate?
Thank you. Thank you, DJ. And this was the short version.
It is.
Tomorrow, if you can, there will be a much longer talk. And as always, it's great to listening to DJ speaking. You know, it's very inspiring. And maybe you understand why we are doing this with a chair. And then we have another co-chair, which I'm happy to introduce, which is Nicola Gray. And Nikki, you are a senior lecturer of pharmacy and pharmacy practice at the Huddersfield University. And you are actually a pharmacist since 1991. So experienced. And you happened to meet DJ in 2018 in Ascot in England. And something happened there. And now you're sitting next to him as a co-chair. I'm happy to give you the floor to tell a little bit about what we're going to do.
Thanks, Hove. Well, now it's my privilege to talk about how we're going to move towards the vision that Didier has just outlined. And of course, we'll be continuing much of the work from the first mandate. But to give us focused activities until 2026, we've developed a scheme of 4 flagship programmes. So you can see that each of them takes account of the 4 activities: the knowledge production and sharing, capacity building and community building, as they relate in emphasis to each topic at this time. So I'm going to take you quickly through each one in turn for a flavour of what's happening and for you to consider where you might like to be involved if indeed you're not already. And because this is all about the people, It's all about the enthusiasm and motivation of people to move these programmes forward. So, the first flagship programme is about health promotion in community settings, and this is really looking at the extension of the delivery of healthcare in community settings into truly grappling with their public health potential. A major programme, continuing from the first mandate, is health promotion training for home carers with Avasad in Lausanne. Okay, so taking people into new realms. Building a common culture among professionals in charge of health promotion, prévention santé, is a key issue. And we continue to do this with the team of Capital Santé, Capital Health, of the group VIV and MGN. We're delighted to have engaged Alison Hemsworth, who is a leading pharmacy technician and runs an international network of her peers, to start a PhD programme this month at the University of Huddersfield. And her studies will be reviewing the concept that we've had in England of the healthy living pharmacy, its policy and its history, to look at how the principles and some of the practices from that programme could be shared with other systems. The French pharmacy system will be a focus, and it could go further afield. We're looking forward to collaboration with other global pharmacy organisations to make that happen. And there are other community settings, such as optometry and dentistry, we have a strong partnership that we can examine, and we have great colleagues in those fields as well. So watch this space. The second programme focuses on healthy and resilient schools. If I can get this to work. Yes. You've already heard about the work that we did during the pandemic to try and learn for the future. We're taking the work that we did then and saying, okay, so that's what happened in that health crisis. And we know that there will be, sadly, more crises. So how do we learn from it so that schools can be more resilient for the future? And how can we support teachers to make this happen? So I'd like to pay tribute to excellent members of our research consortium, including Graça Carvalho from Portugal, Min Chen Sai from Taipei, and Peter Paulus from Germany. Delighted that Peter and Min Chen are here in Paris with us today. And we're also just fresh from the Global Forum for Adolescents. This was a UN multi-agency initiative earlier in October, where we did a session with UNESCO, UNICEF and WHO about the report, Ready to Learn and Thrive. You heard about that earlier at the beginning of this session. That was their flagship report that was published earlier this year. So, healthy and resilient schools, of course, for us is a really strong theme and close to our hearts. Our third flagship theme is around genuine participation, inspired by community activists in Brazil and other global countries. Marco Ackerman is shown here on the slide, who connected us to some amazing young people involved in community activities, and this really motivated us to make this one of our flagship themes. We are on the path to putting a research bid together, determined to learn from gold standard practice. Tinga Telu and Amen El Ghachi will be taking this forward in Clermont-Auvergne. And our final flagship theme is around health learning pathways. You will have heard from Nana about the Yonsu Declaration in 2021 and the guide and the toolkit that has been finalised in its first edition with UNESCO this year, a Herculean task for Didier. Another inspiring activity for Didier and I this year was to go to the Learning City of Cork in Ireland and to see some of the fantastic community initiatives here you can see on the slide. There is a project in Clermont-Ferrand actively looking at health learning pathways across the life course for the people of that UNESCO learning city, and we hope to do a parallel project in Huddersfield, Kirklees. This is something that will develop over the next few years. But none of this is possible without the people who make things happen. This slide shows 8 of our 30-plus stars around the globe, our national representatives who share our commitments, many of whom are either tuning in today or are here with us. We are looking forward to keeping this community moving together towards the vision with the focus of the flagship programmes. Thank you.
Niki, pour cette présentation de la manière dont, concrètement, à ce jour, on perçoit l'évolution de la chaire. Mais l'évolution de la chaire va un peu plus loin que juste ces activités-là. Nous avons choisi...
The interpreters would like to inform you that the time allotted has been that the interpretation was supposed to stop at 4 o'clock. We stayed till past, and we're very sorry, but we have to stop interpreting now.
Le développement durable et de construire ensemble une communauté globale. Eh bien, c'est à deux voix que Rolf Busch, qui est le manager, il s'est présenté tout à l'heure de notre chaire, en gros c'est lui qui fait marcher la maison tous les jours, et Dieu sait s'il y a du travail, vous vous en doutez bien, quand il y a des gens aussi dangereux que nous, qui avons des initiatives et de nouvelles idées tous les matins, imaginez ce que le manager doit faire, c'est un équilibriste. Merci beaucoup Rolf. Donc, Rolf, Joël, à vous pour nous en dire plus sur le futur de ce réseau, une vraie révolution pour la chaire.
Eh bien, bonjour à toutes et à tous. Alors, j'ai expérimenté de marcher sur un fil avec notre équilibriste Gouff. J'ai marché sur un fil avec toi pour pouvoir vous parler ce soir de ce réseau InitWin qui est aussi un fleuron, puisqu'il y a d'autres réseaux InitWin qui existent à l'UNESCO. Mais pour nous, c'est une première, en fait. Nous avons mis un petit peu de temps pour le construire. Nous y sommes. Et nous allons vous le proposer et vous le présenter. Mais avant, j'aurais aimé quand même vous dire un peu ce que ça m'a évoqué, d'une certaine façon, dans le sens même de ce que peut être un réseau InitWin. Alors, il me semble que c'est construit sur 3 piliers. On a parlé d'éthique. Alors, le premier, c'est le partage éthique. Et le partage éthique, il est entre nos 2 chaires, et puis avec évidemment tous nos partenaires. Le deuxième pilier, je pense que c'est la solidarité. Nous en avons beaucoup besoin en ce moment, bien entendu. Cette solidarité de partage de connaissances, on y reviendra, mais aussi cette solidarité humaine. Et puis le troisième pilier, c'est un pilier qui m'est très très cher, c'est aller vers la paix. Je pense que notre réseau InitWin va nous permettre ensemble d'aller vers la paix. Alors, tu veux, je continue. En ce qui nous concerne donc à la chaire UNESCO Santé sexuelle et droits humains, nous sommes abrités par l'université Paris-Cité et notre chaire a été créée en 2010. Elle s'inscrit dans une démarche positive donc, et globale de la sexualité, basée d'ailleurs sur la définition de la santé sexuelle qui a été définie par l'OMS et par la WAS aussi, la World Association of Sexology, et qui vise à garantir à travers ses engagements et ses actions une vie sexuelle autonome, satisfaisante et en toute sécurité, ainsi qu'une vie relationnelle sans violence. Alors, vous voyez que c'est extrêmement large. Alors, notre champ, c'est l'innovation. Donc, nous avons fait beaucoup de choses depuis 2010, en particulier, évidemment, sur le développement durable et pour le bien commun, dans les domaines de l'éducation, de la santé, mais aussi du soin. Alors, pourquoi du soin? Parce que notre chaire s'appuie sur, nous avons un modèle un peu particulier, sur des diplômes interuniversitaires, et des diplômes universitaires aussi, de santé sexuelle et droits humains, de sexologie, puisque nous formons énormément de sexologues, et moi-même j'en ai formé beaucoup, puisque avant d'être à Paris-Cité, j'étais dans une autre université, donc je dirige l'enseignement de sexologie en France depuis très très longtemps. Donc ce modèle est un peu particulier, parce que nous nous appuyons plus finalement sur une formation continue des professionnels, puisque nous ne formons que des professionnels de la santé ou du champ social qui sont déjà dans leur profession. Ce ne sont pas des professions de base. Donc notre pôle, qui est le pôle de santé sexuelle et droits humains, abrite plusieurs diplômes. Et nous avons aussi un diplôme de personne experte en situation de handicap, qui est aussi très actif et très nouveau, très novateur dans sa réalisation. Alors nos buts, évidemment on a une visée dans notre champ anticipatrice et éthique, mais nos buts c'est d'abord de mettre en commun pour ce réseau UniTwin et au niveau mondial, donc nos savoirs, nos ressources aussi, qui vont nous permettre, on l'espère en tout cas, de relever des défis auxquels font face les sociétés, en particulier dans la vie affective et sexuelle, mais pas seulement, évidemment dans l'éducation au sens large, puisque la sexualité et la vie sexuelle fait partie de la santé dans sa globalité. Ça, c'est comme ça que nous la considérons. Et nous nous appuyons pour cela, évidemment, sur les objectifs du développement durable que vous connaissez sans doute, avec un certain nombre de cibles particulières. Le deuxième but, c'est contribuer à cette amélioration de la santé et de l'éducation, évidemment, pour toutes et tous, et en particulier des jeunes, mais aussi des plus vulnérables, parce qu'on sait très bien que ce champ de la santé, on l'a dit plusieurs fois aujourd'hui, et en particulier dans le champ de la santé sexuelle, la question de la vulnérabilité est tout à fait sensible. Et ensuite, agir pour la production et le partage de connaissances, donc pour le changement social, Didier l'a dit, et en faveur d'une santé et surtout des droits humains. Ce qui aussi nous fait notre particularité, c'est vraiment l'articulation entre la santé et les droits humains. Pour nous, c'est extrêmement important et peut-être même qu'on pourrait s'appeler autrement, qu'on pourrait s'appeler Chair UNESCO droits humains et santé sexuelle. Peut-être qu'on pourrait changer, on ne le fera sans doute pas, mais finalement, en avançant dans le temps, on s'aperçoit que cette question des droits humains, elle est absolument fondamentale dans la mise en place de tous les axes de la santé, évidemment, en particulier la santé affective et sexuelle, mais aussi la santé reproductive. Je continue pour ce réseau. Vous en dira aussi un mot. Voilà. Alors, quels sont les principes directeurs de ce réseau? Donc, c'est développer les capacités des personnes à faire des choix libres et éclairés, en tant qu'individus et en tant que membre d'une communauté et habitants de la planète. Vous voyez, c'est quand même un but extrêmement large et on a beaucoup de pain sur la planche. C'est promouvoir la non-discrimination et la non-stigmatisation. Alors nous y sommes évidemment très très sensibles dans notre chaire. La solidarité, je l'ai dit, mais aussi l'égalité des chances et des traitements. Et enfin, l'accès universel à l'éducation et à la santé, ce qui fait que nous avons tout aussi un pôle de développement sur un réseau de santé sexuelle publique, donc pas seulement le réseau de santé sexuelle par les sexologues ou par les travailleurs sociaux ou par les assistantes sociales, etc., ou par les gens qui travaillent dans les CGIT, par exemple, mais aussi donc cette capacité donc à aussi proposer dans le public des consultations. Reconnaître et s'inspirer de la diversité des savoirs et des pratiques et des expériences, c'est un des buts de notre réseau et la nécessité évidemment de les articuler étroitement ensemble. Et ça, c'est aussi dans l'ADN même du réseau UniTwin, c'est-à-dire que ce réseau, il est vraiment constitué de beaucoup d'universités sur des champs extrêmement larges. Et tout ça va évidemment se croise, enfin en tout cas on espère que ce travail va pouvoir se faire pour pouvoir avancer ensemble. Et puis ancrer aussi dans des réalités locales, avec des contextes économiques et environnementaux, politiques, culturels et religieux, bien sûr extrêmement variés et sur lesquels, bien sûr, nous allons aussi nous appuyer.
I will continue now in English. You might have noticed there is no interpretation anymore, so we have to do without. We will work on 4 activities, main activities for the next 4 years. It's focusing on the global collaboration, as we do with both of the chairs in research, training and knowledge sharing. Also working on creating platforms and social networks. Of course, we continue with training and capacity building. The fantastic MOOC that the chair on sexual health has developed is a great example, and we'll continue building on that. The sharing of knowledge with continuing multilingual interactive webinars, and also organizing scientific events. And the summer school is on the planning. And finally, the training and capacity building, which is the same. So this is I can't remember the fourth one. We moved to the next one. And this is a picture of our current 34 partners. When we wrote the application in 2020, it took us a long time because of COVID and to get the application sorted. At the moment, we have 34 UniTwin partners, and we're now in the process of setting up partnership agreements with each of these partners. And from there, we're going to build the UniTwin partner organization. And universities who want can use the UniTwin partner logo in the future for their own work. And it's an example of how we can extend our network working with more universities around the globe on this common goal. Next slide. And actually, we have created a website which is on the UNESCO Chair site. And main contact person is actually Sylvia de Ruiter, who hasn't spoken yet, but she's sitting next to me and doing all the tech work. So this was it, and over to you, DJ, for the closing words.
Écoutez, ça va bientôt être l'heure du cocktail. Vous nous laissez juste le temps de dire merci à tout le monde et puis surtout de vous permettre de toucher du doigt que demain, on va prendre le temps ensemble, j'allais dire, de partager les différentes expériences de ce qui fait vivre la communauté. Vous vous rappelez, la communauté, c'est d'autres chaires UNESCO, comme celle de Joëlle Mignot ici présente, c'est des universités, donc les deux nôtres, d'Huddersfield et Clermont, mais aussi l'université Cheikh Diop, qui est un partenaire de très long terme de la chaire. C'est le réseau éducation et solidarité, c'est l'équipe prévention de la MGEN, c'est Capital Santé de Groupe Vive, c'est de plus en plus dans le futur la Docène, c'est le She Network, le réseau des écoles pour la santé en Europe. Ivania Pavic, qui en est la responsable, nous envoyait un message. C'est évidemment l'Association internationale de santé des adolescents, l'Union internationale de promotion de la santé, l'Union des syndicats qui est Education International, et puis le réseau UNIRES. Donc, vous voyez, c'est simplement, on est une petite part d'un écosystème, et c'est ça la communauté, avec tous les gens qui veulent prendre part aux activités de la chaire. N'oubliez pas que la recherche et la formation, elle est au cœur de notre travail à travers notamment les universités, mais aussi tout ce qui relève du transfert de connaissances et du dialogue avec les acteurs, par exemple de la VASAD, de Prosenectute qui sont ici, des entreprises du médicament qui nous rejoindront demain et de l'ensemble des acteurs. Ici, il est fondamental simplement que vous sachiez que quand on fait la liste des gens qui font tourner la chaire, on est à plus de 120. On n'a rien fait, c'est juste que voilà, les gens sont là, on y travaille. C'est d'abord, on l'a vu, Rouf, Sylvia, Valérie, Tinga. C'est aussi pour la préparation, Carmela, Samuel, Minchen, Daniel. C'est aussi des personnes qui arrivent, Benoît, Eyman, c'est l'équipe opérationnelle, c'est-à-dire Stéphanie, Marie-Pierre, Françoise, Karine, Philippe, Julie. C'est notre comité de pilotage, Adesola, qui est juste devant nous ici, Nane, bien sûr, à la tribune, François, qui s'est exprimé au départ, Charlotte, Fadi, Sean. Vous réalisez? La chaire, c'est vraiment nous tous, et c'est vraiment un collectif tous ensemble. Alors à Huddersfield aussi, il y a une équipe opérationnelle. Et Niki, je te laisse terminer avant qu'on libère tout le monde pour se ruer vers les photos, parce qu'il y a une photo booth à côté pour que vous puissiez chacun individuellement en groupe vous faire un beau portrait devant les logos de la chaire pour garder mémoire de cette belle journée. Oui, vas-y.
Thank you so much. Didier has already paid tribute to the many, many people who've made today possible, who took part in the first mandate and who will be working with us in the second. I need to add some thanks to colleagues from Huddersfield here today, so Barbara Conway, Jim Reed, Somto, of course, Hayley Gorton back at home, Bob, of course, for coming to be with us today. And their support in the application for the second mandate and in the starting and the founding of the research group has been immense, and great thanks to them. We are planning a UK launch of the chair in Huddersfield on the 28th of November, and anybody would be very pleased if you would like to join us. I was also delighted to find that my ambassadors to UNESCO, Anna and Zabuges, sitting in the back row there at short notice, has been able to join us. I'm so grateful for sitting here and learning more about the chair. She's, she's a fantastic voice for the UK in the UNESCO family. So we hope that I've already invited Anna to be with us in Huddersfield in November, and her team in London do a brilliant job. So we hope that this is very much, sort of like, not only is it collaboration between health and education, it's a collaboration, it's hands across the channel between France and the UK and all our global partners here, as you have heard. So proud to be part of this today. And please do now join us. There is a photo booth that we would like everybody to come and have a photo taken in front of the chair's logo as a memory of our wonderful day here together. And then we will be moving to the Ibis Hotel Chambron for cocktails and champagne, if one wishes, straight after this, So thank you so much for your attention, your indulgence in letting us run over just a little bit, and thank you again. Take care.